Dr. Grace.
Good
And
morning, all.
good morning. My name is Dr. Hope, and I'm here with Dr. Grace. And we are here with the live question and answer session with us, the endocrinologists. So we are here to just answer any questions that you may have, any endocrinology related questions. And our area of specialty, so endocrinology, involves the study of glands, right? So they're glandular disorders, and you may or may not be aware of the fact that diabetes is controlled by a gland called the pancreas. So if you have diabetes questions, any thyroid related questions, any questions related to the pituitary. So some of you may have pituitary problems that affect your reproductive hormones, your growth hormones, your prolactin. Any questions related to that? The adrenal gland. So that's the gland above your kidney. If you have questions related to that, we are here to answer those questions as well. Anything else, Dr. Grace?
Yes, so we just try to see how today looks like, being a live Q&A. We want to step forward, not just doing the uh, recorded presenting, since we are Ask Endocrinologists. So we want to come live and hear from you guys. Whatever question that bothers your mind, it's okay if you don't have any question today. You could just say hola or say hello to let us know you are there, and let us know what interest you have in any hormonal questions that you want us to talk about as well. And in anything, let's just be interactive for the next 10 to 15 minutes while we are live today, and we take it from there. And you can also use this link, share with your friends, your colleagues. Yeah, I can see Samuel saying hello, Oliemisi saying hello. Hello, everyone. Thank you, and welcome to Ask Endocrinologists. Welcome to Ask Endocrinologists.
All right. We also can answer questions on polycystic ovarian disorders, so or PCOS, as you may know it. Like we said, the reproductive disorders, even infertility can be related to some OBGYN.
Yeah, there's a question coming up, Dr. Hope.
Okay, all
They
right.
said, please, I would like to know more about imbalanced menstrual cycle. Please, yeah, I want to ask question. I want to know about the imbalanced menstrual cycle.
Okay, so the menstrual cycle could be irregular, so meaning that you can have your menses 1 month and then the next month you don't have it, and then then you have it again, so it may be off and on. So we call that irregular menstrual cycle. And what causes that, right? So there could be many causes of that. If you've had a period and then it becomes irregular, then that means at least you have a uterus and you have ovaries that you're able to actually have a period. So it actually cuts out a lot of disorders, the genetic disorders. But one of the common disorders that causes that is polycystic ovarian syndrome. It's irregular periods due to an imbalance between estrogen and testosterone. So you have more of the male hormone, more of the testosterone, and that can lead to irregular periods, meaning that you're not ovulating, you're not releasing the eggs on a consistent basis every month. So it may manifest as hair growth on the face, like your chin and upper lip. Also, it may lead to acne as well. And usually there's some weight gain, so people may be a bit overweight. But how do you treat it? There are several ways to treat it. Birth control pills help control the cycle. And also, if you're attempting pregnancy, there are medications like Clomid or Clomiphene that help, because sometimes people have difficulty getting pregnant. And with the aid of some medications, you actually can become pregnant, and lifestyle changes. So just losing the weight can actually help treat polycystic ovarian disease. Other causes of irregular periods could be the prolactin. So, like in the brain, you can have a lesion. So, other endocrine causes I'm talking about. So, elevated prolactin levels from a pituitary adenoma. So, it increases the level of prolactin in the blood, and that suppresses the release of the reproductive hormones. So, therefore, you lose the period. Other things that can cause it are thyroid disorders. So hyperthyroidism or hypothyroidism can also cause that. So how do you treat, first of all, the prolactin secretion? It's treated with medications, like bromocriptine or cabergoline. And then the thyroid, if it's hyperthyroid, it's treated with medications like methimazole, PTU in emergencies or the first trimester of pregnancy, and then low, if it's underactive thyroid, it's treated with thyroid hormone replacement, like with levothyroxine and syndrome. So those are some common causes of irregular periods. Anything, Grace? Or?
Yeah, just to add the little sense, that stress on its own can actually also make your hormone imbalance. So when you are going through psychological stress, emotional stress, all these things can also alter your physiologic hormone production. So one of the things I will always say is that common things are common. First, try to consider if you are going through stress, if you are sleeping well, if you are eating well, if you're resting well, your hormone can automatically become balanced on its own. Then all the hormone imbalance problems that could be because of what Dr. Hope has mentioned as well. So let's just consider everything. Eat well, relax, and yeah, you have the tendency to have your hormone coming returning back to normal. And some people usually experience it after giving birth, because after you've given birth, post pregnancy, everything is deregulated and changing back. So that too can take time. So it's always good to watch. And if it continues to persist, don't hesitate to talk to your doctor about it.
Yeah, and to add to that, after giving birth, if you breastfeed, it takes a longer time to get your period for the periods to return. Which breastfeeding is good, and if you can, you should breastfeed because it's healthy for the baby. So, but as you breastfeed, it may take a longer time for your periods to return.
To
Um,
return.
yeah, but thank you for that question. That's a great question. Thank you.
Yeah. And by the way, I just want everyone to know, if you don't know Dr. Hope is a graduate of Yale University. She did her medical school and graduated from NYU, and she's our great doctor here. So you are opportune to ask questions from the right person. And I was opportune to be trained under her. So I just finished my my fellowship as an endocrinologist under her tutelage. So it's an opportunity to be here to ask any question that you have.
Thank
Okay.
you so much, Grace, for that gracious introduction.
I know you don't like it, but I have to I have to always let people be aware of the people in front of them right now in their home, and the opportunity to ask that kind of question. Okay, so there is another question here, and the question says, how do hormone influence growth and development during puberty? I guess this question is from someone who is undergoing puberty or a teenager and would like to know, um, how does hormone, or if you're a parent asking on behalf of your child, how does hormone influence growth and development during puberty?
Right. So during puberty, there are a lot of things going on, right? A lot of the hormones are working, I think, overtime. So there are several hormones. So the growth hormone is a hormone that continues to grow from childhood, obviously, and into adulthood. But it's very important, and the regulation is very important, especially during the younger ages up until puberty. So that is constantly working. The thyroid hormone again is constantly working, but I think the the hormones that are maybe initiated around puberty, the hormonal regulation is that's when young girls start having a period, right? And then the males also start going through changes with their hormones. So the estrogen level increases during that time. So then it helps the woman develop like this more breast development, and then like I said, the periods start, and that's due to changes in the estrogen, like increases in your estrogen hormones, and that's also controlled by the brain. There's a hormone from the brain called follicle stimulating hormone that helps stimulate that as well. So during puberty, those things lead to the development and maturation of organs that become fully developed and into the adulthood. So then you start at that time, because of the estrogen and because of the cyclical regulation of the estradiol and progesterone, you start to develop follicles, and that leads to ovulation in the woman. And then, the eggs are released every month. So that's a very important hormonal change that occurs during puberty for women. For men, the testosterone again increases, and then they're able to, that's where you have the change of voice, because the testosterone changes lead to increased, stronger, more deep voice, right, in the men. And it leads to the hair growth, like they start developing a beard and mustache, and there's hair growth, in reproductive areas as well. So those are some of the changes that occur with the hormones during puberty.
Yeah. Yes, and that's very important. Thank you, Dr. Hope, for that detailed explanation. And I also strongly believe in making sure that you feed yourself. It's good nutrition meal, as it really helps to optimize your hormone and help you to be able to do well and grow well as you should. Yeah. Yeah. So there's another question, that how do scientists study and treat hormonal imbalances? How do we diagnose? How do we know that there is an hormonal imbalance, and how do we treat this hormone?
Okay, that's a good question. And it sounds like a future scientist.
Yes.
So I think one of the ways is, so you can do it from a uh, lab, from the lab, or from a clinical setting. So there are two different approaches, right? You can study things in the lab, and you can study things clinically. As a clinician, I'll start, with the clinical. But clinically, it's based on symptoms. So if someone presents to you with certain symptoms, that leads you to obtain tests that would help you identify which hormone is causing this problem. So based on the way the patient presents, then you look for the hormone, that will be causing that problem. So like if someone comes in with weight gain, dry skin, constipation, and feeling tired all the time, then I think, oh, they may have a thyroid hormone deficiency. So then we do studies to evaluate for the levels of thyroid hormone. So if someone comes in with an unusual one that we could talk about is just low blood pressure, weakness, fatigue. It could be a cortisol deficiency or something called adrenal insufficiency. So then we do studies to evaluate the levels of their cortisol hormone. So clinically, it depends on symptoms. From a lab standpoint, they use, there's different trials like phase 1, 2, and 3 trials. But in the phase 1, they look at animal studies and evaluate. They actually have mice that are injected with a certain deficiency, and based on that, evaluate to see what the outcome is when given certain treatments or not given certain treatments. So they're called knockout mice. So depending on what you're studying, the mice are evaluated in the lab. So yes, it can be done clinically and also in the lab. These things can be studied.
Yeah. Yeah. So basically, if you notice you are not growing as you're supposed to grow, or you feel like probably by now your pediatrician is already concerned, or you feel like your classmate is growing taller than you, and you already having concern about that, yes, those are things that you don't want to wait, because you have your window of growth, and you just need to let your uh, pediatrician know and see what else they can do. Measure your hormone, like Dr. Hope said. They will check your blood level to see if you have enough hormone growth level, and then the rest is your nutrition, your exercise, your sleeping well, and you making sure you are eating healthy meal, and yeah,
Okay.
making sure you're not lacking those vitamins as well.
Yeah. And one thing to add to that, Grace, is that look at the height of your family members. So if
Yes.
if you have a very tall family, like both your parents are tall and you're not growing, then that's more concerning, as opposed to if your parents are short and and you're short and you're taking a longer time. It's not as worrisome because it may be just a genetic pattern. But
Yeah.
definitely, look at the height and of your other family members, parents and other siblings, and
Hmm.
compare that to your own height, and that also is a factor that's taken into account in growth.
Yeah. Yeah. Okay, we can take one or two questions more, and we can call it a day and share it. And by the way, if you have not subscribed, please subscribe to this channel. And we hope to be more consistent, whereby we will be meeting at least twice a month, and we'll let you guys know when we'll be showing up. Uh, yes. So, what could be causing a hormone imbalance? I think we did this question before. But the question came back again as what could be causing a hormone imbalance, and what are the best treatment options available?
Right. So there are a lot of different types of hormone imbalances, right? There's the thyroid hormone imbalance, there's estrogen hormone imbalance, there's cortisol hormone imbalance, and testosterone hormone imbalance. So they're different hormones. So you have to identify which one it is by doing the blood tests. And then once you identify which one it is, then you can replace the hormone. So yeah, it just depends on which hormone imbalance you're referring to.
Yeah, yeah, absolutely. Absolutely. Well, so there's a question here that how do athletes use hormones to enhance performance? Well,
Mm.
I don't think it is allowed to use hormone to enhance your performance. You always want your natural hormone to grow and build up. And most of this can be built by you just continuously, persistently doing your exercise, and you stabilize your hormone level this way. And eating nutrition, having good nutrition rather, and resting well, all this can help you enhance your hormone performance when you are doing the right thing. Having to use a supplement from outside can actually damage your own body hormone, because there is an axis that your body creates from the pituitary, your brain, to the gland where that gland is into your system, and then it circles back to your brain. So if you take something from outside, you automatically cut off that axis that is running in your bloodstream, in your brain. And when you continue to take the one from outside, your own endogenous, which they call endogenous, it stop producing. And when you stop producing your own endogenous one, you might end up not having enough or sufficient one to help you for many other things that one from outside cannot do for you. So you want to always avoid hormone enhancement therapy. So over to you back again, Dr. Obo,
Oh,
for
that's great. Thanks for answering that question so well. Thank you, Dr. Grace.
yeah.
Yeah.
So how do the next question says, how do I avoid diabetes? My both parents are diabetes. And
Mm,
what can be done to totally avoid diabetes?
that is a great question, right? One is weight loss. So if you look at trends around the world, in the United States and around the world, the increase in type 2 diabetes, which is the most common type, follows the increase in obesity. So the number one thing you can do is keep your weight under control. Number one. And how do you do that? By the diet, your diet, and exercise. So the diet should consist of mostly vegetables. So we have, when we're seeing our patients, we show them a nice chart, which of the plate, or a nice diagram of the plate, which
Mhm.
shows that half your plate should be vegetables, a quarter protein, which is meat, beans, um, and then a quarter carbohydrate. So like the rice or pasta or potatoes should be just a small portion of your plate. So one thing, controlling your diet, number one. And so portion control and the types of foods that you're eating definitely is key in preventing diabetes, and exercise. So at least 30 minutes of some type of aerobic exercise at least 4 days a week, 4 or more days a week. So it should be like a baseline to help prevent diabetes. So I think that's the key, really, diet, exercise. If you do find that you are pre-diabetic, you're at the point where you're pre-diabetic, in addition to the lifestyle changes of exercise and controlling your diet, cutting down on carbs, sweets, carbonated like sodas, sweetened drinks, juices. Drinking more water actually helps. So in addition to that, there are some medications that have been proven in addition to lifestyle changes to help prevent your progression to diabetes, and metformin is the main one. It's used to treat diabetes, but it can be used to prevent progression from pre-diabetes to diabetes. But I think weight loss and controlling your weight is the key, number one. Anything else, Dr. Grace?
Yeah, you're absolutely right, Dr. Hope. Yeah. Absolutely right, because um, there is a saying that what you eat is what you are. Although some people can be resistant to what they eat, or they are not responding well to what they eat, but nonetheless, we just want to be careful what we eat. There's this saying in Africa that when you are poor, you don't have money to eat whatever you want, and then now that you have money, you want to eat everything. That is not true. Because when you then get rich, you want to be careful what you eat. Not because money is the solution to your health, but because you want to be very careful not to eat something that will harm you when you become rich. So eat more of fruit. There is no harm in anything green. That's what I always tell my patient. Like, whatever green on your plate is good. You know, whatever orange on your plate or yellow on your plate is mine. Red means, ooh, it's not healthy that much. So look at what you are eating, go for the green. We don't like to eat everything green, but sometimes you just have to put yourself under that subjection, like, you know what, I have to take it for my own health sake. Yeah, so exercise and move around, do exercise, be disciplined to do so, and drink a lot of water, as you said too. And then if you've tried everything and you realize you are in pre-diabetes mode, like Dr. Hope said, it's good to take metformin to just help to prevent the progression of the diabetes so it doesn't get worse and start causing complications in your body. All right. So we would like to stop here for today so that everyone can go on with their daily activities. We are very happy for everyone who showed up today. And for those who have questions still and we're unable to answer, we will definitely put the answers in the comment section, or we will talk about it in our next live Q&A. Be free to ask your question, any question you have. Even if you are forgotten at this point or you don't have any question at this time, you can always drop it in our comment section. We will look into it and we can talk about it at our next video.
Thank you so much. Thanks for joining us.
Thank you all. And we're happy to have you all here today. Thank you.